So when a child, you see the skin is red and then next minute a boil is forming, like a big pimple, and then it now comes to a head, then that boil is ready to pop and it will end up popping and then pus will come out.
Hello everyone, I'm Francisca, and with me here is Dr. Sanusi Ekuase, founder of Pediatrics To-Go. Today we're going to be talking about, or rather she's going to be enlightening us about abscesses in children, otherwise commonly known as boil or ewo in Yoruba language that we are very conversant with. So hi Dr. Ekuase, how are you doing?
Hi Francisca, and thank you once again.
You're welcome.
So today we're talking about boils, and the reason is we see a lot of boils in pediatric practice. Now, why do children get boils? And people ask me, what caused it, doctor? Why did my child get this boil? Now, in general, we have bacteria living on the skin, and anytime we have a scratch, we can actually open up like a space for the bacteria to get underneath the skin. And when there's bacteria underneath the skin, that's what we call cellulitis. Cellulitis means infection of the skin. Now, when children or adults start to localize the infection, and it starts to form like a bump or a swelling, then that means the immune system is trying to kill the bacteria that is underneath the skin multiplying. And if there's pus forming in there, that's the antibodies. Pus comes as a result of the immune system producing antibodies and all the white cells to try and kill the bacteria. And that's when we develop boils. So anytime you have a boil, your skin will get raised up, you'll have tenderness. Infection usually comes with pain. So when a child, you see the skin is red and then next minute a boil is forming, like a big pimple, and then it now comes to a head, then that boil is ready to pop and it will end up popping and then pus will come out. Now, if you go to a doctor and the boil is just starting, it might not be ripe to pop. But in medicine, we say anytime there's pus in any part of the body, it should be removed. So some people might have an infection around the fingernails, and then you see the nails start to, yellow starts to form around the nails. Yes, that's called paronychia. And we usually just put a small needle there and drain it, because if we don't, it's going to probably burst by itself, but it's better to take the pus out than if you put a child on antibiotics, then it can kill whatever residual bacteria is left. If you are able to drain everything, sometimes some doctors say, oh, we drained everything, there's no more bacteria in there, it's healed. So some doctors might not even put a child or an adult on antibiotics if all the pus was drained. And but in general, when there's an infection and there's been an abscess, in the past we would send all the pus that is collected for culture. Some people still do, depending on how much pus you're collecting. When you send it for a culture, usually it will grow either staph or strep or both. Because staph and strep are the commonest reasons that we get boils. And that's because staph lives on the skin normally, but when it multiplies and it's too much, or if we have a boil, a scratch in the skin, then it ends up becoming an abscess and then it has to be drained. Now we see a lot of boils in areas where there can be increased bacteria. So we see a lot of boils in the butt area, especially in between the folds of the butt. And when we see that, we have to go in there and drain it. And sometimes you might even need an ultrasound, because if they have a buttock abscess, you don't know how big it is. And you might think you have drained everything, but you haven't. So sometimes if it's huge, we do recommend go for an ultrasound and then let it be drained under ultrasound guided drainage and incision and drainage. So the doctor will go in and cut the boil open and drain it. And sometimes they might leave a pack in there so that the residual pus can drain, and then that pack is kind of like a string with packing, and you put it in there so that it can absorb the pus, and eventually you're pulling out the string with the residual pus, and then that wound heals with secondary intention, which is basically the body healing itself, and then the string comes out gradually. So those are extreme cases of boils and incision and drainage, but generally we tend to drain the pus, and then depending on how bad the infection is, we do oral antibiotics just to kill any residual bacteria that wasn't drained out.
Okay, so what are those boils that happen like under the armpits that makes that, those ones that don't have pus in it? So can you talk about those ones?
Now those ones are outside the scope of our
of your
talk.
practice.
Yes, but we do have a lot of people that have hydrogenitis. Basically, it's infection of the sweat glands in the. So a lot of times it might not be pus coming out, it might be sweat, and there's like a bacterial infection of the glands, and then they might need to be on oral antibiotics, but that might need to be drained, and sometimes you might need to drain it over and over and over again because it gets reinfected, or it gets the sweat gets kind of like enclosed in a sac, and then it needs to be excised or removed. But if it's something that is a recurrent thing, see your doctor, and then they might need to do some other tests and some other procedures for you.
Oh, wow. Thank you very much, doctor. We're always excited to listen to all this. So until next time, guys, thank you so much for listening. I hope you have learned one or two things today. So bye.
Bye.